Over the summer, a bill was passed in Washington that provided $17 billion to upgrade Veterans Administration facilities across the country.
Part of that legislation provided funding for upgrades to the Chattanooga VA clinic, but those upgrades won't be completed for another 5 years. News Channel 9's Josh Rowe joins us now with that story. Josh.
Calvin and Latricia, on Friday we spoke to Congressman Chuck Fleischmann about the timeline for this project. It was the first time he has spoken to the media about when these new VA services will be in Chattanooga. A new VA clinic in Chattanooga is not expected to be completed until 2020. Over the summer, the planned upgrades got a lot of attention. That end date that is now 5 years away did not.
Once we appropriate, it goes to the administration, to the Veterans Administration, to actually implement that. We give them the funding and then they move forward with the logistics. That's where the problem is. They've been a little bit lethargic and slow in terms of getting it done.
Part of the legislation provides funding for an interim facility in Chattanooga that will bring some of those new services here before 2020. The VA is already advertising, looking for space.
The interim facility is going to be expanded. The good news about the project, as it's been explained to me, is we're going to have more services for our veterans. We're going to have podiatry. We're going to have an emphasis on mental health facilities. We're going to have ophthalmology and optometry.
But exactly when that interim facility will be operational is still unclear.
Myself and other members of Congress who have approval for leased facilities, additional leased facilities in their district, are writing a letter to Secretary McDonald at the Veterans Affairs to basically say, Mr. Secretary, when are we going to see these facilities come into fruition?
The bill passed in the summer of 2014 with overwhelming support in the House, 420 to 5. The spending breaks down with roughly $5 billion to upgrade facilities and hire staff across the country, and $10 billion to allow veterans who need it to see non-VA doctors.
My concern and my frustration has been, it's been about 6 months since we actually passed that, and we've yet to see any specific action.
3 VA clinics opened in Tennessee's 3rd Congressional District last year in McMinn, Roane, and Campbell counties. We'll have more on this story, including reaction from local veterans on Wednesday, 6 o'clock, during the Price of Freedom. Calvin.
Thanks, Josh.